So I'm basically heading the Department of Emergency Medicine at HCMCT Manipal Hospital, Dwarka. I'm also the DNB faculty and external examiner for National Board of Examination. I currently hold the position of president and core committee members of AEPI. I'm also the international examiner for Royal College of Emergency Medicine. Today we are going to discuss an important topic which is very common and seasonal and has got a very mortality. So we are going to discuss about the dengue. So how the dengue spreads. Dengue is basically a viral infection which is transmitted by the mosquitoes. So the vector which transfers this virus is basically Aedes mosquito. There are two genotypes who transmit this virus. It's Aedes aegypti and Aedes albopictus. And causative agent is basically dengue virus who has four serotypes. Serotype 1, 2, 3 and 4. So we have seen that the incidence of dengue has increased over the past few years. We record 100 million cases every year worldwide, and global incidence of dengue has also increased dramatically. In India also, it is on the sharp rise. Basically, it is seen in tropical and subtropical region where the rain is very common, and they breed during the rainy seasons. So it is common in Indian subcontinent, Mexico, Africa, southern China, and South America also. Here is the epidemiological evidence of the dengue cases. So more reddish color shows how much incidences of case and prevalence are present. You see more are there on the South America. Some of the cases will be noticed in China, Australia, India, and many more countries are involved. If we talk about the India, we can see the number of prevalences is very much high in the states of Punjab, Haryana, and Delhi, and Uttarakhand and Uttar Pradesh, Rajasthan, Madhya Pradesh is also involved in a significant numbers. So let's talk about how the dengue presents. So clinical syndromes, basically dengue is benign and self-limiting. You see 50 to 80% of cases are asymptomatic or having undifferentiated fevers, which last for 4 to 5 days and has got an incubation period of 7 days. You can see dengue fever as classical dengue fever, which is called as breakbone fever, or it can present as a dengue hemorrhagic fever, where you see the hemorrhagic manifestation like bleeding from the gums and reddish spot on the skin and bleeding from the gut also. And rare complications like dengue shock syndrome, where the patient present in hypotension. So dengue basically is a disease which progress in three phases. First phase is the febrile phase, next phase is critical phase, and the last phase is the recovery phase. So we'll talk about in details about these phases. First, let's talk about the febrile phase. It generally stays for a week and patient presents with high-grade fever with chills and presents with headache, generalized arthralgia, myalgia, severe body aches, and you will notice some reddish spot on the skin called PTK. It can present as a bleeding from the mucous membrane, most commonly from the gums, and rashes may appear in 50 to 80% of the cases. Next case, when the febrile phase is over, patient may land up into the critical phase, where you notice that the patient has got decrease in plasma platelet levels, which is called a thrombocytopenia. And also, if you get a blood test, then you will see that the TLC count is also on the lower side, which is more or like classical in dengue fever called leukopenia. And one classical thing that you see in critical phase is increase in the capillary permeability, which leads to plasma leakage from the intravascular compartment to the extravascular compartment. And you notice that there is a swelling in the feet, you see swelling in the abdomen, you see swelling over the face. It's none, just the fluids over the subcutaneous tissue. And one metabolic derangement that it causes is metabolic acidosis. Children's and in pregnant females, febrile phase is common and may present with nausea, vomiting, and thrombocytopenia. So last phase that we see is the recovery phase, which is very common, and approximately, as I told you in previous slide, that 50 to 80% of the people recovers. So their hemodynamics stabilize, their output stabilize. There is an overall clinical improvement that we see in the patient. Sometimes when we do not do judicial fluid resuscitation, sometimes we are giving the fluid more and more to the patient. It may land up into a situation of fluid overload, which can also cause edema into the brain. So always there will be a judicial resuscitation of the fluid in dengue cases. So let's talk about the signs and symptoms that we see in a dengue patient. As I told you, patient present initially with a high-grade fever. He may present with a headache, muscle pain, and joint pain are very common. Rashes may or may not appear, but if they appear after 4 to 5 days. There may be retroorbital pain, which is the pain behind the eyes. There may be nausea, vomiting, and mild bleeding could be seen. What are the warning signs? Warning signs are basically the signs which are commonly found in patients who need to be admitted or hospitalized or be vigilant of. So main symptoms that you see is severe abdominal pain, persistent vomiting. Vomiting could be there with the blood also. Patient may appear irritable, drowsy. Patient may present with breathing difficulty. He may have prostration, diarrhea, and swollen lymph nodes as well. So WHO has also proposed a clinical definition of dengue, where you can suspect a probable dengue case in which patient has an exposure in an endemic area and present with fever. And if you find the other symptoms like nausea, vomiting, rashes, body ache, and one positive tourniquet test, I will tell you how to do the test in later slide. Leukopenia will be evident in blood test and any warning sign as I told you previously also in the previous slide. So laboratory confirmation is important as we are going ahead with the diagnosis of dengue, and patient may require a regular medical observation. That is not necessary to be an inpatient monitoring, that could be done on the OPD basis. If patient is presenting with no warning signs, the need for hospitalization is depend upon a lot of factors like if the patient is an elderly patient, patient has significant comorbidities like patient is has a cardiac heart issues, has stroke issues, patient is severely diabetic or hypertensive, or there are certain social factors associated like there is no one to take care of the patient at home. So those kind of patients may require to be admitted in the hospital even though they are presenting with a milder symptoms. So dengue may present with warning signs. So there may be dengue with one of the symptoms that you see is pain, abdomen, vomiting, collection of fluid. So collection of fluid could be in the chest, that is called as the pleural effusion. It may be in the abdomen, it may be called as an ascites. And there may be bleeding from the mucosa. Patient may present with lethargy. You may find hepatomegaly on clinical examination. And if you send the blood investigation, you will see the rapid increase in hematocrit because there is a dehydration at the cellular level. So you may notice the fall in platelet count, which is called thrombocytopenia. And in all this situation, you might require medical intervention, that to intravenous fluid, to resuscitate you properly and prevent the dehydration that is ongoing. So one more presentation that dengue present with is severe dengue. So what is severe dengue? You got severe plasma leakage that leads to a shock syndrome that is called a dengue shock syndrome. So fluid accumulates within the chest wall, making the patient complain of respiratory problems, most commonly shortness of breath. Patient may present with severe hemorrhagic manifestation like bleeding from the gut. Patient may complain of passing black color stool or passing vomiting with blood. There may be other organs involvement like liver, where you find the liver enzymes to be raised, most commonly more than 1,000. And if you talk about the neurological status of the patient, patient may present with impaired consciousness, he may present with drowsiness. There are some cases where we report cardiomyopathy in dengue patients because of circulatory failure also or fluid overload also. Other organs which are commonly involved is the basically kidneys, which is because you are dehydrated on the cellular level, so there are no enough perfusion to the kidney. So your creatinine tends to rise during the severe dengue case. So in these patients, patient requires emergency medical treatment and a specialist care, that too in ICU. So as I told you that there is a test called tourniquet test where you inflate the blood pressure cuff between the diastolic and systolic pressure for 5 minutes and you see a positive repair when there is a 10 to or more than 10 PTKs as a reddish rash over 1 inch area or 2.5 centimeter square area. In case of dengue hemorrhagic fever, there may be more PTK, more than 20. And if it is the shock syndrome, dengue shock syndrome, you may find this test falsely negative because there is no enough circulation that to maintain the blood pressure. So you may find this test negative in those cases. So laboratory features that we see in dengue is leukopenia, that is low TLC count, neutropenia where neutrophils count decreases, and thrombocytopenia, as you already know, that platelet falls during the dengue infection. You may find liver dysfunction in terms of liver enzymes, which is ALT and AST, which got raised, as I told you already, they got into the 1,000 limits. And you may find dengue viral material in serology or by RT-PCR. So how do we diagnose that it is a dengue case? Clinically, we have seen many manifestation of dengue fever, but let's talk about diagnosis of the dengue. So one test that we do on regular basis is dengue specific IgG or IgM ELISA test, which got positive for IgM antibody on or after 5 days of the fever. So body tends to form some antibiotics after the infection. This IgM ELISA test has sensitivity of 83.9 to 98.4 and specificity of 100%. So you can very well see the specificity of 100%. So you can diagnose this easily with this case, and it is readily available at every center. You can also do dengue NS1 test, which can be done on the day one and shows a good specificity and sensitivity when done in initial stage of the dengue fever. Other tests that you can do to rule out whether there are some associated symptoms is chest X-ray, where you can appreciate pleural effusion that shows the extravasation of fluid due to vascular leakage within the chest cavity. And you can find pericardial effusion, that is the fluid around the heart on echo. And as I told you, there may be fluid in the abdomen, which is called ascites. Management is basically supported, which is bleeding prevention and control. You may require to resuscitate the patient with fluid. So you have to replace the fluid adequately and judicially, and symptomatic relief in terms of body ache or fever control. So basically you are in a state of infection. So your body tends to have high body temperature. So you require vital monitoring on regular basis. There might be hypovolemic shock, which can be due to hemorrhage, which is going on from the body. And there might be fluid loss due to the migration from the intravascular compartment to extravascular compartment, and impaired nutrition because of the disease process which is going on. So patient feels like decreased appetite. So what can we do to fight dengue? With a simple diet tips. You can consume more of protein-rich food, increase your water intake, eat more green leafy vegetables, eat easily digestible foods, and have more fresh fruits rather than having fruit juices. You can drink juice extracted from papaya leaf also. It's found to be beneficial in dengue cases. So let's talk about the prognosis. So basically, most of the infection, as I told you, are asymptomatic or presenting with undifferentiated fever. So they recover after a period of 7 to 10 days. Very few of the cases tends to feel very ill during the period of 1 to 2 weeks of illness because of the disease process that goes on, and the recovery phase takes some time to recover the patient. So as you notice that the fatality rate is only 1%, that too in cases of the severe presentation like dengue hemorrhagic fever or dengue shock syndrome. Let's talk about the complications that we encounter during the dengue fever. I told you earlier also, it is the dengue hemorrhagic fever, disseminated intravascular coagulation that leads to deranged coagulation profiles and may lead to bleeding from the other sides. And dengue shock syndrome. Patient may present with hepatitis, may present with cerebral hemorrhage or edema encephalitis. These can be presenting complaints in any of the patients. There have been seen cases of vertical transmission if the infection is happening within the 5 weeks of delivery also. So most of us that get confused that what is dengue hemorrhagic fever, dengue shock syndrome? Is it different from the normal dengue? It is basically a complication of dengue fever, which any patient may land up or may get affected during the course of illness. So let's talk about in detail about the dengue hemorrhagic fever. WHO has classified with 4 of the symptoms that for dengue hemorrhagic fever, that is fever, any hemorrhagic manifestation, low platelet count, basically less than 1 lakh, and elevated hematocrit more than 20% of the normal or 50% than of the baseline. Criteria for dengue hemorrhagic fever is similarly, as we told you, that we diagnose the dengue with the lab investigation, and we look for the hemorrhagic tendency, which can be seen in positive tourniquet test. You can see the PTK, ecchymosis, and purpura. There may be bleeding from the mucosa. It can be gum bleeding. It can be bleeding from the injection site. It can be bleeding from the GI tract. A patient may present with hematemesis, frank bleeding from the oral cavity, and melena. Patient may complain of passing the black color stool. That may or may not be associated with thrombocytopenia. Patient may have pleural effusion, ascites, and may also present with hyperproteinemia. So these are some of the skin manifestation that you see of hemorrhagic manifestation of dengue. You may see purpura, gingival bleeding, nasal bleeding, oral bleeding, and hematemesis. Similarly, you may notice the bruises on the body, petechial hemorrhages. Patient may complain of regular bleeding from the nose, that is called epistaxis, during the course of illness, and there might be conjunctival infection as well. Let's talk about the last manifestation that dengue presents. It is the fatal one, and very few people land up into this situation. But I must tell you, when this situation occurs, then it is a very difficult situation to control, and fatality rate is very high. So, the dengue fever presenting with dengue hemorrhagic fever plus the evidence of circulatory failure, which may be manifested as weak and rapid pulse and narrow pulse pressure, or you can say hypotension for any age. So, what do you do for the management? It is no different from the management that we are doing for the other dengue patients, but we have to be very vigilant, because as the patient is already in a state of shock with bleeding manifestation, so you do all the things that you do for every dengue patient: supportive care, you take care of the temperature, you control their anxiety, you control their weakness, and fluid resuscitation. That can be done with steroid and colloid. And blood component therapy becomes an important part, because there may be hemorrhagic transformations, and you may need to give patient packed red blood cells, fresh frozen plasma, and platelet concentration, whatever the clinical presentation that you are getting. Whether it is a deranged coagulation profile, whether it is a low platelet count, that is thrombocytopenia, or patient is losing blood wholly, so you need to replace it with packed red blood cells. The other requirement that patient may present with oxygen requirement, as there may be collection of fluid within the chest cavity, that I told you as earlier, that may be fluid leakage within the chest cavity that present as pleural effusion. So patient may present with shortness of breath. So that would cause the patient for the requirement of oxygen therapy. So despite giving the blood and fluid resuscitation that you have done with crystalloid, colloids, and any of the component of the blood that you have given, and still you are not able to achieve your blood parameters and your target BP, so you need to introduce inotrope support that could be given by dopamine, epinephrine, norepinephrine, milronin, and dobutamine to maintain the mean arterial pressure or the target BP of the patient. So as I told you that packed blood cells are given only when there is a loss of 10% or more of the total blood volume. You may find patient to be in a refractive shock condition even after you have done an adequate fluid administration and you have given the fluid up to the maximum level that the body is allowed. If you suspect the patient is landing up into the fluid overload situation, then it's better to switch to a packed red blood cell rather than giving them the plain fluids. So I want to break the misnomer of giving the platelet in the condition of low platelet count. I must tell you that there is no need to give prophylactic platelet even if your platelet count goes below the 20,000. You may need to give it in a situation where it goes below the 10,000, or if there is a evidence of bleeding manifestation. You can also give platelets in case of shock with coagulopathy or whenever there is a massive bleeding. Fresh frozen plasma and cryoprecipitate are reserved when there is a coagulopathy with bleeding. So this may be considered as per the advice of the physician. So how can you defend the dengue? As you know, there is no proper cure or vaccination for the dengue. So all we can do is the prevention of the disease that we say, and there are multiple national program which is going on as National Vector Control Program, which says that you prevent the disease before it happens. So how can you do that? First thing that you can do foremost is remove the water from your coolers and other containers that may become a breeding ground for the mosquitoes. and they may breed and bite you in future. And you can use aerosol product during the daytime to prevent the bite. Always wear the full sleeves clothes to prevent bite, and use nets and repellents during the daytime when you're sleeping or during the night time. So this is all about the dengue. Let's just talk about few things about the chikungunya as well. What is chikungunya? Chikungunya is again a mosquito-borne viral disease which is transmitted to humans by alpha virus that is spread by the bite of infected Aedes aegypti and Aedes albopictus mosquito. So word chikungunya means to be contorted as the affected person walks in a stoop posture because of the joint pain. So there is severe joint pain in case of chikungunya. So chikungunya is caused by chikungunya virus. Chikungunya virus is basically a member of alpha virus genus and Togaviridae family. It was first isolated in 1953 in Tanzania, and it is an RNA virus. It is spread by same arbovirus that is spread by the arthropod, and mosquito itself is an arthropod which spread the virus from one person to the another. So how do the transmission of chikungunya happens? It happens the way the dengue is spread. The infected mosquito carries the virus within them and multiplies. And Aedes virus, when it bites the normal or healthy individual, the virus spreads within the individual and replicate further on. So let's talk about the epidemiology of chikungunya. Chikungunya has been identified in 60 countries in Asia, Africa, Europe, and America. It was first described in Tanzania in 1952. Beginning in the 1960s, periodic outbreaks were documented in Asia and Africa. However, since 2005, following several decades of relative inactivity, it has re-emerged and causing a large outbreak in Africa, Asia, and America. In 2005, an outbreak happened on island of Union, was the largest then documented. It was approximately 2,70,000 cases reported on that island with a population of merely 7,72,000 people. And in 2006, outbreak happened in India, where 1.5 million cases was suspected and reported to be. So chikungunya was recently introduced to Americans, and from 2013 to 2014, we have seen the cases to be reported to be more than 11 lakh. And confirmed cases was 24,862, which was reported by Pan American Health Association. So again, the symptoms appear between 4 to 7 days after the patient has been bitten by the infected mosquito. And commonly presenting signs and symptoms are high-grade fever with chills. There may be severe joint pain, mostly involving the ankle, knee, wrist, and phalanges. There may be joint swelling. There may be rashes over the body, and patient may present with headache, muscle pain, fatigue, and nausea. So these are the symptoms, pictorial depiction of the symptoms that patient present. Again, vomiting, fever, rashes, headache, myalgia, arthralgia. So mind you that the clinical signs and symptoms matches with dengue. So you can misdiagnose the patient as dengue in a case in an area where the dengue is very endemic. So several methods has been introduced to diagnose the chikungunya. You can do the ELISA test, which may confirm the IgM and IgG anti-chikungunya antibodies, and you may run the RT-PCR to isolate the virus. The treatment, again, there is no specific antiviral drug treatment for chikungunya. Treatment would be supportive. It primarily aims to give you support like giving the antipyretics for fever control, optimal analgesics for the bone pain and the joint pain, and fluid resuscitation so that you may not land up into dehydration. So there is no commercial chikungunya vaccine till date. The only measure that we have is the prevention that we can do, and adequate supportive care that can be given on inpatient basis or outpatient basis depending on the condition of the patient. So prevention of chikungunya, again, similar to the dengue, control the mosquito population by limiting their habitat. Empty your containers which contains water, and you can use insecticide or biological control agents to control it. You can use insect repellent, and wear long sleeves and trousers to offer your skin protection so that you prevent the bite. And you can use the screen for the windows and doors at house that will keep the mosquito out of the house. Thank you. We can move on to the session of question and answer and discussion. How to control diabetes in 40s when there is a family history of diabetes. Diabetes is basically a lifestyle disease. Uh, Family history makes you more prone to catch up in your early stage of life. All you can do is living a healthy lifestyle, take healthy diet, and do regular exercise. All these measures can only help you by preventing the disease. And obviously, if you contract the disease, then you have to take the medication to prevent it going into the more uh, uh, dangerous and complication stage. Shivja has asked, will chikungunya have permanent side effects with the ankle swelling and muscle pain on the patient? No. So basically, this is a disease which is during the phase of illness only. Patient recovers fully after the disease has stopped or has passed on. During the recover stage, you may have some residual weakness or pain, but that will recover with adequate diet, and with the passage of time, you will recover 100% with it. Amit has asked, what is the reason behind, and there is no medicine to cure these diseases. So the problem is that these are caused by the viruses, which tends to mutate very commonly. And for every season and every outbreak, they have a different genotype, which is very difficult to control by a single vaccine. Even if you produce a vaccine to control the known serotypes, it will mutate every year and every season. So with the vaccine itself, you won't be able to prevent the disease from happening. Vishwajit is asking, is there any vaccine available for the dengue and chikungunya? So as of now, there is no vaccine available for dengue and chikungunya, but they are in a process to develop the vaccine for, I think, dengue. But still, it is not available on the commercial basis. What kind of a natural food helps to gain the normal health and stamina? See, there is no mantra to do a dieting or anything. You can have home food. You can have more of pulses in your food, more of fiber in your food, and timing of the diet is very important. In today's lifestyle has become very much chaotic, where people tends to at any time of the day or any time of the night, that makes your body more prone and more non-immune towards the infections. So I would suggest to take the natural diet, take whatever regular diet you do it at home, prevent outside food, prevent oily food, and more of the salty food, and take natural food, seasonal foods, and that will help you to boost up your immunity, I think. No, children below the age of 1 year are more prone to dengue or chikungunya. No, we can't say that. Every children right from the birth and till the age of whatever age, elderly age, it is the same chances to contract the infection. See, you can recover from the dengue and chikungunya very well, even if you don't do anything, just take the adequate hydration, because dengue and chikungunya is self-limiting and they have a period of their illness and they recover. As I told you, 80% of the cases recovers with no residual problems. So you can recover after the phase of illness. Only thing that you have to focus upon is building up your immunity by taking fresh foods, healthy diet, and continuing the hydration of the body. How to boost platelet count in case of dengue fever? See, various misnomer has been going on in the community that you eat papaya or you eat ginkgo seeds or the commercial preparation of these seeds. I think that has not have any conclusive evidence that they increase the platelet. Only thing that I told you that it is self-limiting disease. Even if it is breaking down your platelet, so platelets reborn in your body, they are remade in your body every 7 days. So normal platelet has got a period of 7 days to 10 days of lifespan. So even if it is just destroyed during the phase of illness of dengue, it will be recovered of its own after 7 days. So you don't need to worry about. You have to be just vigilant. If it is going below a significant limit, as I told you, going down below 20,000 makes it a more vigilant, because you may have a manifestation. And if it is going below the 10,000, then you may have to go to the hospital for getting the transfusion and admissions for further management and monitoring. I think there are no more queries. You can reach out to me anytime. And we at Manipal Hospital Dwarka have equipped with every support to help you in case of any illness. And these dengue and chikungunya illnesses are very common and seasonal outbreaks are there. they tend to pick up during the rainy season, that with July, August, and September. So we are at your care, and hopefully, if you need any suggestions and any consultation, we are available.